future nurses? Welcome to your essential guide to safety and infection control for the NCLEX. This isn't just about passing the test, it's about being an amazing, safe nurse. Let's dive in. 1. Stopping falls, fall risk and prevention. The big idea: we want to keep patients from falling. Falls can cause serious injuries, especially in older or weaker patients. Who's at risk? Older folks, they might be unsteady, have poor eyesight, or weak muscles. Confused patients, dementia, or even just being in a new place can make them forgetful. Patients on certain meds. Some medicines make people dizzy or sleepy. Anyone with a history of falling. What nurses do to prevent falls: think safe environment. Keep the bed low, always, and lock the wheels. Call Light Handy. Make sure they can reach it and know how to use it. Clear the path. No clutter on the floor. Good lighting, especially at night. Non-slip socks shoes, super important. Help with walking. Use walkers or canes if needed. Frequent checks. Pop in often, hourly rounds. Are you in pain? Do you need to use the bathroom? Alarms. For super high-risk patients, bed or chair alarms can alert us if they try to get up alone. Tell everyone. Educate the patient and family about fall risks. 2. Stopping germs. Standard and transmission-based precautions. The big idea: germs are everywhere. We need to stop them from spreading to protect everyone. Standard precautions. For all patients, always. What it means: treat everyone's blood, pee, poop, and other body fluids like they might have germs. The golden rule: hand hygiene. Wash with soap and water. If hands are visibly dirty, or if caring for C. diff patients, a super stubborn germ. Hand sanitizer. Most other times if hands aren't visibly dirty. When? Before, after touching a patient. After touching dirty stuff. After taking off gloves. PPE, personal protective equipment. Gloves, when you might touch body fluids. Gowns, if splashes are expected. Masks, eye shields, if sprays or splashes might happen, like coughing or suctioning. Cough etiquette, cover your coughs and sneezes. Extra precautions, transmission-based for special germs. Why? For specific infections that spread easily in certain ways, we use these in addition to standard precautions. 1. Contact precautions. Germs spread by touch. Examples: MRSA, C. diff, really bad skin infections. What you do? Wear gown and gloves every time you go in the room. Keep equipment just for that patient if possible. Room. Private room, or share with someone who has the exact same germ. 2. Droplet precautions. Germs spread by big cough, sneeze droplets. Examples: flu, mumps, whooping cough. What you do: wear a surgical mask when you're close, within about 3 to 6 feet. Room, private room, or share. Patient on the go. If the patient leaves the room, they wear a surgical mask. 3. Airborne precautions. Germs float in the air for a long time. Examples: TB, tuberculosis, measles, chickenpox, COVID-19. What you do: wear a special N95 mask. You need to be fit tested for this. Room, private, negative pressure room. It sucks air in, not out, so germs don't escape. Keep the door closed. Patient on the go. If the patient leaves the room, they wear a surgical mask. Quick tip: donning and doffing PPE, putting on and taking off. On cleanest to dirtiest, gown, mask, goggles, gloves. Think GMGG. Off dirtiest to cleanest, gloves, goggles, gown, mask. Think GGGM. 3. Being ready for anything, disaster preparedness. The big idea: nurses are superheroes when disaster strikes. We need to know what to do. What kind of disasters? Earthquakes, floods, big accidents, even a power outage. Your job: know the plan. Your hospital has an emergency plan. You need to know it. Triage. In big emergencies, we sort patients quickly. Who needs help now? Red. Who can wait a bit? Yellow. Who's okay? Green. Who can't be saved? Black. We try to save the most lives. Communicate. Speak clearly. Tell others what's happening. Be prepared yourself. Have a family plan so you can come to work and help. 4. When we use restraints. Use of restraints. The big idea: restraints are a last resort. We only use them to keep patients and staff safe and with very strict rules. What are they? Anything that stops a patient from moving freely. Wrist ties, vests, even medicines if used just to keep them still. Why use them? To keep them safe, if they're pulling out IVs, trying to hurt themselves or others. Never for convenience. We don't use them to make our job easier. What to do before restraints? Try everything else first. Talk to them, move them closer to nurses, get a family member, offer distractions. The rules. Doctor's order: must have one, and it says what kind and for how long. Orders expire quickly. Check constantly. Every 15 to 30 mins for agitated patients, or every 2 hours for others. Are they too tight? Is the skin okay? Can they move their fingers, toes? Do they need to use the bathroom?